name is Julie, and I'm Marshall's wife, and it's just been an incredible journey these last 2 years, from the time that Marshall was diagnosed with alpha-1 antitrypsin deficiency and knowing that he was going to need a transplant. It was very difficult because being on the transplant list, well, first of all, you have to wait a while before you can actually get on the list, and also knowing that many people die each day waiting for organ donations. One of the things he struggled with was encephalopathy, which is when the liver has cirrhosis. It starts sending out toxins into your body, and it causes your mind to not think clearly. And so he would be literally like an Alzheimer's patient some of the time. The telephone would ring and he would just pick it up and look at it, and he just was such a different person than the person that we knew, and that was really, really difficult for our family. His encephalopathy really complicated the dieting, because he didn't really always remember what he'd eaten, and it was, I'm sure, frustrating for the dietitians, but they continued to be encouraging and helpful to us and didn't give up hope. That final month when he did become sick enough that he was towards the top of the list, and it seemed that he would be able to receive an organ if that came available. That waiting, as he became closer and closer to death, it just was, it was like your worst nightmare, really. When we decided to come to Mayo, we were just so impressed on our first visit here. They were so thorough, and they communicated so well, and the team approach just really works. I think my daughter once was told that during one of the hospitalizations, one of the doctors told her, you know, we have some of the greatest minds talking over the health of your father, you know, trying to figure out what's best for him, and that was a really comforting thought to us. Right up to the transplant, I just knew that I could follow their advice, and regardless of the outcome, I could trust that they had made the best decision. Since the transplant, we have a very different perspective on life. It's like each day is a gift. We appreciate the time that we have together and the time that we have as a family. Before the transplant, I think we were less focused on our health and just having a healthy lifestyle, and that's definitely more of a priority now. We recently rode our bikes, our bicycles together in the St. Paul Classic, which was something I never thought that would ever happen, and it was so much fun. After Marshall was diagnosed and there was such an uncertainty about what our future held, I kept thinking of the various things that we had talked about doing and hadn't done yet, and had a lot of regrets. And now that he has a second chance at life, we're trying to take advantage and do the things that we weren't sure we would ever be able to do together, and just be able to enjoy our life and hope that when we get to the end of our life, we can look back and know that we lived life to the fullest. I can't say enough good things about the care that we received at Mayo. After the transplant, Marshall ran into one of our dietitians, and he said hello, and at first she didn't recognize him, and then when she really I think when she heard his voice, she's like, Marshall, and she was so happy to see him and how good he looked and how much weight he'd lost, and she was literally crying. She was so happy. And that's really, it's been the way our experience has been with all of our providers here at Mayo, is they just take a personal interest in you and really care about you as a person. And then again, our doctors were just amazing. They pulled off one miracle after another. And I honestly don't think I think if we hadn't been at Mayo, I don't think Marshall would be alive today. And I'm so grateful for all of their care.